What was kind of the tipping point when it came to healthcare benefits that brought you to say, I'm going to do something about this?
The real tipping point was getting double-digit premium increases year over year over year. Felt helpless, and it's a bad feeling when you lose control. We were talking about being competitive. I wish that the carriers were coming back with 9 to 10%. We were seeing increases of 15 to 18% year over year. It was just atrocious.
When Jim and I first started talking, he was incredibly frustrated with their experience year over year of working with the big box carrier, seeing 20+% increases year over year. Their employees make on average $11.50 an hour, and having to pass those costs on to their employees was an incredibly painful thing to do.
And these are folks who are making anywhere from $11 an hour, $15 an hour, and it just becomes an unaffordable option for them. And if we want to take care of our people, you just had to have that happen. And so in our community, through our chamber, I've gotten to know Mike Hill with Coldbrook Insurance, and he invited me to a session, and much like our colleagues here, it was like, wow. I mean, you actually can get into it and you can see the detail. But when we were talking with Mike and his team, we really figured out that we could put together a program and manage it like we do with any other business line that we have.
Most employers have been conditioned to think that there's nothing they can do about healthcare. They can shop around and try to find a lower price from another carrier that might be willing to buy their business, but that's the extent of the ability they have to control it. After having Jim attend a number of our educational events over a few months period of time, he kind of started to realize, wait a minute, there is another way to go about this, and we can control this if we're willing to think about things differently.
Mike and his team at Coldbrook really were the most transparent, really came across and proven themselves as knowing what they were doing. They got in every detail of the plan. They gave us facts and figures. They weren't guessing. There wasn't, I don't know, I'll have to get back to you. And part of that is they gave us great confidence that making a change to this type of approach, we could do it.
We want to allow employers to manage their health plan the way they manage every other aspect of their business. And by starting from the ground up and building custom plans for each employer, we're allowing them to do that. We've been working with a number of larger employers like Jim's, and we're continuing to start relationships with more employers that are really willing to look outside the box and think about things differently. And so we want to continue to tell the story and share the successes and really help employees get better care at lower costs, and it's as simple as that.